so honored to introduce Dr. Paul Byrne. He has been an amazing friend to the Life Legal Defense Foundation, to me personally. I consider him a good, dear friend. He is a board-certified neonatologist and pediatrician. He is effectively the father of neonatology. He founded the first neonatology intensive care unit in the United States, I believe in the world, at Cardinal Glennon Children's Hospital in St. Louis. He is a clinical professor of pediatrics at the University of Toledo College of Medicine. He is a member of the American Academy of Pediatricians, and a Fellowship of Catholic Scholars. He is the past president of the Catholic Medical Association, the producer of the film Continuum of Life. He is the author of several books, including Beyond Brain Death, and Finis Vitae is Brain Death, True Death, and both of which I highly recommend. And Finis Vitae is actually available at Dr. Byrne's table in the display room. He has testified on life issues before 9 different state legislatures. He has appeared on Crossfire to oppose Jack Kevorkian. And in addition to, he has also provided testimony in a number of court cases, including some of ours. And I just have to say, when we get a difficult case, a case involving brain death or somebody who's been brain injured, and we need a physician who will testify for us, I know I can call Dr. Byrne. Literally, I have called him in the middle of the night saying, I need a declaration tomorrow morning, or I need testimony by a certain date, and he is always there without fail. I can't say enough about the sacrificial giving that this man does day in and day out for the cause of life.
Thank you. So just imagine what would have happened if I didn't go away from lunch a few minutes early to come over and practice and get all this set up so that it would work. In any event, there's a lot of things I could say that would be less serious than what I have to say, but it just takes time. First of all, I want to tell you about a few patients, and these patients are part of a family. The things that I'm going to tell you about are the same things that could happen to any one of your families. So you need to identify with these. And speaking of families that are here, Dan and Bernice Jones are here. They are parents of a child who was declared brain dead, and they learned about how he was dissected alive to get his organs. And they are here in attendance at the audience, and they help me with our table. So if you have time after we're talking, be sure you go to the table and talk to them. They have experienced how awful this thing is, and so talking to them, and you will learn firsthand what this is all about. On this slide, I tell you about Jahai McMath. Jahai McMath was 13 years old, and in California had tonsil surgery, post-op hemorrhage, and then had a cardiorespiratory arrest. And they said she was brain dead, and her mother got on TV and pleaded, won't someone help? And my son was there, and he poked me and said, well, Dad, what are you going to do? So I got on the plane and came to California to start to help Jahai. Jahai was 13 then. They had a death certificate issued on her on October the 12th, 2013. We managed to get her out of that hospital and get her transferred to New Jersey. New Jersey is the only state that has a conscience clause that says that if the relatives do not accept brain death, they don't have to accept it, and they have to keep treating the patient. It's the only state. New York has it in their rules and regulations. It's not as strong as New Jersey. Other states, like California, have a pseudo clause that says you have to give the relatives some kind of information, but then it gets carried out on them anyway, so it doesn't mean anything. New Jersey is the only state that has a conscience clause. In any event, she did get transferred to New Jersey, where they did a tracheostomy and a gastrostomy. Those are things that are necessary to treat a patient who's on a ventilator for any more than about 2 weeks. And if you don't do it, they're destined to stay in the hospital and die. But we managed to get her out of the hospital, get her to New Jersey, where she started to get some treatment. She was there for about 9 months, and then home, and there, Jahai was 13, and this is a picture that was there, published when she was 15 years old. And there's a picture of Jahai's hand and my hand, and when Jahai's mother showed some pictures of her fingernails, you can see that they are painted and decorated nicely. There were comments that came back, well, how do we know that's Jahai's hand? So when I was with her, I had the picture taken, and you see the bracelet that's on my wrist, that's my wrist, and her wrist, and it has a bracelet on it, and it says, Jahai is alive on one side of it, and the other side of it, it says prayer works. And when I went to see her, her mother gave me that and said, that's what you said when you came to see her in California. And so she made that bracelet, gives it to a lot of people. There's Jahai on her 17th birthday, a picture of Jahai. And often I get asked when I tell people about Jahai how she has a death certificate in California, and she still does, and she lives in New Jersey. And then they sometimes they'll say, well, does she walk? Does she talk? Because that's what they want. Well, there's a picture of Jahai with the telephone listening to her grandmother. Jahai moves slowly. When her mother says, give me a thumbs up, it takes her a while, but she gets a thumbs up. Raise your right leg. She can raise her right leg. Jahai is very much alive. There's a picture of her attorney pointing to, you can see this is an MRI, but you see a lot of brain there that she's has brain, and of course all of this stuff about brain death, it's all a big lie. It has nothing to do with death. Brain death has to do with life. Everybody who's called brain dead is alive, but they made it up so that they could get organs for transplantation. And then if somebody says, no, you can't take organs for transplantation, like Jahai's mother said, no, you can't take her organs, then they said, so then the next thing that happens, they must make them die. And they want to take away the treatment, and they must make them die because as you'll see with some of these, as I keep on showing you things, if they don't make them die, every day that Jahai lives, it tells the rest of the world that there was something wrong when they called her dead, and they could have dissected her alive, and her organs could have been transplanted all over the place. And everybody, every day that she lives, it tells everybody, tells the whole world that there's something wrong with what's happening. There's Joseph. Joseph in 1975, born prematurely, was in nursery, and I was taking care of Joseph. And he wouldn't move and he wouldn't breathe, and a brainwave test was done, and his brainwaves were flat. And what's on his chart is consistent with cerebral death. It was suggested to stop treating him. I continued to treat Joseph, and there's Joseph when he's 7 years old riding the bicycle. And there's Joseph and his wife and 2 children, and after that they had another child also. Yes, we get excited and you applaud, and thank you very much. But the significant thing is, yes, Joseph is alive. He lives in California, by the way. I tried to get in touch with him, but it's been several years since so I couldn't get in touch with him before I came. And I think he lives in Los Angeles, too. But eventually I'll catch up with his mother and him and find out what's going on. But the significant thing, besides that he is alive, Joseph was the patient that was the stimulus to my starting to study the subject of brain death. And remember, it was 1975. It took about 2 years till I understood the subject, and I wrote my first article, medical journal, peer-reviewed journal in 1977, another one in 1979 in the Journal of the American Medical Association that was widely distributed throughout the world. So I've been telling people about this for a number of years. Sister Paula and I were comparing notes about how, when we started. She has 50 years of celebrating pro-life work, and I can tell you that I did my first testimony at the legislature in Missouri in 1967 in opposition to abortion. So 50 years, I think, was what she said. And then we don't want to go any further, but 55 years I was able to practice medicine. And then if you put that all together, I would prefer to stand up and talk, but I sit down. The reason I sit down is because my legs get tired if I stand up, so I sit down. There's other things that happen to you when you get older too. You know, when you have children, you tie their shoestrings and you double knot them so they don't come apart. When you get older, you double knot your shoestrings because you can't bend over to tie them anymore. Now, I'm going to back up here for just a minute because I want you to turn the lights down, sir, in the back there. If you turn the lights down, because I want you to be able to see this. The next recording, I'll leave that there so I can tell you about it. But the next recording is Takesha. Takesha is a 27-year-old young lady who is alive in Canada at this time. On September the 14th, put that in perspective, it was a couple of months ago, September 14th, she did a dumb thing and overdosed and got in the hospital, and she was breathing on her own for several days. But somewhere in there, they decided that she was brain dead. On September the 20th, a death certificate was issued on her in Canada. And actually, at about that time, I was in New York and scheduled to go to New Jersey the next day. And they called from Canada, and so I canceled New Jersey, went to Canada, and did some things to try to help her. So remember, 2 months ago, September the 20th, she had a death certificate in Canada. She lives in the hospital in New Jersey, in Canada. Alex Schattenberg was instrumental in getting me to participate in her care in Canada. And I just want you to see this. I want you to see this. I'm going to ask you, is she dead or is she alive? That's all I'm going to ask you. And you just get to see this little bit here.
You can squeeze me. Yeah. You can squeeze me. Yeah. Yeah. Just show me, your thumb. Yeah, show me you know your thumb. Good girl. Good girl. Almost there, baby.
How many say she's alive? How many say she's dead? Nobody. That's what brain death is. Brain death is a big, big lie. It's been a lie since the very beginning. It's like all lies. When you tell a lie, you must tell another one. I can remember as a kid, whatever it was that I lied about, and my mother got a hold of me, and of course, about that time, my father got involved too, and of course, what was I doing as a result of the lie? Telling another lie until eventually they convinced me, no, Paul, you don't do that. You got to tell the truth. I don't know what it was that I did, but it was probably pretty bad. But in any event, that's what happens with lies. Brain death is a lie. It's been a lie from the beginning. It continues to be a lie. It will never be the truth. You can never make the truth out of a lie, and brain death is a great big lie. And so Takesha, she has these movements. She continues to move, but they say that doesn't count. Why? Because brain death is a thing that's set only whatever the neurologist says has to do with whether you're alive or dead, and no one else can say anything about it, just the neurologist. That's how it is. And I'll tell you more about it as we go on. But here's the important thing. The important thing to learn is that each one of us is a living person. And how do we know that? We know it from common sense. We know it from medical science. We know it from biology. We're alive from conception until true death. And every cell, tissue, and organ and the organism, these are biological terms. Cell is the basic unit of biology. Cells go to make up groups of cells to make up tissues, groups of cells and tissues to make up organs, groups of organs and systems that to make up the organism. So we are an organism, one organism, unity of the body. There's an interdependence. Remember that, interdependence. That part of the lie is to make it like when you're alive, when you have integration of your brain, and if they can't see integration, then that means you're dead. Is how it works. But some of this has to do with words, but I want you to remember certain things, only certain things. One is interdependence of cells, tissues, and organs that are necessary to maintain the unity of the body. The unity of the body is a unity of the body and the soul. Remember what we heard earlier about the biological, the psychological, and the spiritual. It's a unity, it's one, each one of us. That's what they are. No one organ controls all the other organs of the body. Life on earth is a continuum from true conception, I put in there because they distort the word conception. True conception is a continuum with its ups and downs until true death, and then death is there and it's the remains of someone. Preservation follows creation. That to have preservation of life on earth, once it gets developed to a certain part, the heart and with the circulation is necessary. And the heart is a fascinating organ. The heart doesn't need the brain to beat. The heart beats on its own. The heart has its own nervous system built into it, its own little brain, if you want to call it that. Dr. Armour, who's from Canada, it's his language, a research physiologist, it's his language that would talk about the little brain that's in the heart. The heart has its own nervous system that makes the heart beat, and then the nervous system makes it stop beating too, its own nervous system. And then the heart is part of its own endocrine system. What's the endocrine system in the body? It's something that's made and gets carried to another part and has an effect. The heart has its own endocrine system. It's the endocrine system in the heart that with the circulation, the blood vessels works on the kidneys, and that's what maintains our blood pressure. It does that in you, in me, and everybody who's called brain dead. The same thing is going on. We have to breathe oxygen in and carbon dioxide out for preservation. And water we need, food we need. To get back to the breathing oxygen, we need oxygen all the time. Without oxygen, we're dead within minutes. Without water, we're dead in 1 to 2 weeks. Without food, we're dead in 1 to 2 months. So preservation follows creation, and these things are necessary. Granted, there's different ways to get the oxygen, but it starts immediately at creation when we're just one cell, and it's continuous and is necessary all the way until the end of life. Proper temperature of the body and the environment is necessary, and there has to be exits for urine and stool. These are fundamental for preservation, and all of us need that for life on earth to continue. Interdependence of organs and systems, and I already told you about the heart and the kidney, energy balance, maintenance of body temperature, that goes on. These things, healing in somebody who's brain dead, they heal, they fight infection, they get fever, and sometimes when they cut on them to take the organs, they don't give them an anesthetic, and when they cut on them, their heart rate goes up and their blood pressure goes up. These things go on. People that are called, everyone who's called brain dead is alive. And incidentally, every organ that's taken for transplantation is a healthy organ, and it comes from a living person. And the living person, after the organ's taken, always is either killed or made weaker with every organ that's transplanted. The dead is something different from being alive. It's an absence of life. The Greek word for life is bios, biology. You get that. The Greek word for disease is pathos, pathology. And so you see, life has to do with bios. Death has to do with pathology. It's a different thing. So we know life, death. What happens at death is what we have left on earth is the remains, the remains of someone. In the remains, it's not functioning, but there's something more than just a lack of functioning. It isn't just that the heart has stopped, but the heart has stopped with the lack of oxygen for a period of time or something that happens to it so that you have destruction. The basic structure is changed. So in death, the structure is changed. It's over and above just the lack of functioning. So, yeah, and we have words in medicine, in pathology. We have words that we can describe what the death is like. We use words like destruction, disintegration, dissolution, corruption, putrefaction, decay, rigor mortis. And in the beginning, we can tell this under the microscope, but eventually it becomes that anybody can tell it. The skin falls off, it gets stinking, that kind of thing. So you can tell, but we might not be able to tell the instant of death, but once it's there, we know it's there. And we also know what life is. To think that somebody, and to call us part of, in Canada, by the way, part of why they didn't care for my testimony was because I told them I would not call somebody, declare somebody dead just on the basis of absence of functioning of their brain. I wouldn't call them dead when their heart's beating and they got circulation and respiration. Well, that doesn't go along with what they want to hear, so they strike my testimony. And so I get used to that. But I hope you listen to me. After true death, and the church, by the way, the language of the church for a long, long time has been Latin. So the church has had words for true death. Mors means death, vera is true. So after true death, what remains on earth is a dead body, a corpse, a cadaver. The Latin word is spelled the same, but it's pronounced differently. It's pronounced cadaver. And so it's the same one word, but the remains of someone is empty. Empty. Where did I get that word? I got that word because of my wife explaining to one of our grandchildren at the funeral of her mother, explaining the remains of the corpse, explaining the situation between her mother and him and all that kind of stuff. And with that, Matthew was about maybe 6 years old, and he said, "No matter what, Grandma, she's empty." That's what a corpse is. It's empty, okay? And Takesha's not empty. Jahai's not empty. Joseph's not empty. They're all alive. Yes. And so a cadaver, empty, without, listen to this now, if you don't want to use the word soul, then use dynamic principle. You know, principle is good, make it dynamic. Dynamic principle. If you don't believe in souls, use dynamic principle. But it's a soul-body unity that we have during our entire time on earth. And then the Catholic Church had another term called mors apparens, death, apparent death, so that sometimes when you couldn't tell, and that was used to give the sacraments and other things, that kind of thing. But it's that way. Sometimes we can't always tell, but let me tell you, I can tell Takesha's alive. She's not dead. You can tell, but the dumb court can't tell. Yeah, in Jahai, they're going to have a hearing in another year or something like that about Jahai so that the court can decide whether she's alive or dead. All the judge has to do is go see her. That's all. And use his common sense if he doesn't use anything else. And they know that Jahai is alive. She's not dead. You know, Takesha's not dead. And so here we are. Okay, now alive or dead? It doesn't make any difference if you're educated in theology or philosophy or medicine or the law, or if you have little or none of that education. The facts and the truth are the same. They're identical. When you start talking about sensation and other things that philosophers talk about and all that kind of stuff, it's important to them as they have their discussions around the table. I used to call them the pipe smokers. I don't mean to put them down, but they would, when I was a student, they would smoke a pipe and that kind of thing and talk about it and think. These kind of things are important. And yes, we do need theologians and philosophers and doctors and lawyers for different things. But on the other hand, we can tell the difference between life and death. And everybody can. Now, brain death is not based on any kind of science that would be acceptable for anything else to make advances in medicine. The Harvard criteria was without any studies on dogs, cats, or rats, and there was no patient data. The Minnesota criteria, likewise, only studied 9 patients, and 2 of them had brainwave tests. Listen to the conclusion. Conclusion was no longer did they have to evaluate brainwave testing, and with that, the requirement of brainwave testing was thrown out of the criteria for brain death. And then the NIH criteria was the largest study that's reported in the literature. They called all the data, and then they recommended that the criteria be recommended for a larger clinical trial. 1977, here we are 40 years later. It's never been done, and it won't be done. Why not? Because the goal and objective is to get organs. And they're getting organs, and they want some more, and they keep making up more reasons to get organs. There were 30 disparate sets of criteria published between 68 and 78. You could be dead by one, but you'd be alive by the other. What is brain death, the neurological criteria? They really check only 3 things. One is that if you're unconscious and in a coma. Another is you have to be on a ventilator. And then you have absent brainstem reflexes, but it's only the brainstem reflexes that have to do with the function of the eye or the function of the ear or whether you have a cough or gag. They only check 6 of the brainstem reflexes. There are 14 of them, but the other 8 they don't pay attention to. Why? They're more difficult to do and they hang around longer. The goal and objective is to get somebody dead. That's what this is all about. And then it's the procedure of the apnea test. Remember the patients on the ventilator. They take the ventilator away for 10 minutes. They suffocate them for 10 minutes. And if the patient's unconscious in a coma, and they have to show that they can take a breath. If they can't show that they take a breath, that becomes a signal to have their beating heart cut out, to have their organs cut out. And EEG, they're not required to do it. The brain scans, Jahai had a brain scan, and her technician scan, it doesn't show anything. You see her brain, she has very much a brain, she's very much alive. 4 years later, you can look Zach Dunlap, and you can Google him. He had 2 technetium scans, and you will see him talking on the TV about, the interviewer said, well, what did you want to do? He said, I could hear them. I wanted to get up. I wanted to throw them out the window. He could hear them, but she said they can't respond. They're unconscious and that kind of thing, and can't respond, but they're all alive. There's no test that's absolutely positive for death, except the fact that when there's nothing, no circulation, no heartbeat, no respiration. But in any event, the declaration of brain death is the signal to do something else that kills them, either cut out their organs or to stop the ventilator. Now, if you don't do that, they can live for an extended period of time. How long? Well, Jahai is several years. Takesha continues to live several months. I don't know how long they're going to live. I don't know how long you or I are going to live. I just know that they're all alive. Each one of you is alive. I'm alive. And so we have to do the best we can. How about TK? TK, I could tell you his name because he was a patient that I took care of. And Todd had meningitis, and then afterwards was in a coma, and at one point, Todd's blood pressure went down, and the nurse called me, so I went over to the hospital, and his mother was sitting in the bed, sitting on a chair next to Todd, and I said to her, Renee, Todd's blood pressure is going down. I said, do you want me to do anything about it? And she looked up at me and said, well, is there anything you can do? I said, well, sometimes we give medication for blood pressure, and sometimes it'll come up. And she looked up at me and she said, well, get on with it. I'll never forget it. I gave him the medicine for blood pressure. His blood pressure came up. He lived 20 years. 20 years. Most of it was at home after that. And of course, then I told you about Jahai, and then Alan, a year and a half ago in Montana, almost drowned. Again, it's the same way. His parents called for help, so he'll go to Montana, and we start treatment. We have treatment for these patients. Every patient that their brain swells, they don't make thyroid-stimulating hormone. They get deficient in thyroid. You have to give them thyroid. All the doctors know this, but they don't do it. The only time they'll give them thyroid is if they're going to be an organ donor, and that's to make their organs better for somebody else. It's absolutely awful what's happening. And there's other things that you do to help the patients too. Jahai was in the hospital in California, had no nutrition for a month. For a month. She was starved for a month before we got her out of that hospital and got her someplace to get some nutrition into her. And these things are going on. And yes, we're here talking about it. Nice, beautiful, wonderful campus, and we're all comfortable as can be. And let me tell you something, folks. This thing could be happening to your family or my family or anybody else's family. Alexandra Snyder and I work together trying to help more patients, Israel Stinson and the like. We do our best to help them. And why do we get a chance to help? Because some mother, some father stands up for their child. And in the meantime, all of you should be standing up for your children and your grandchildren. And we at our table, we give booklets out. All you have to do is go pick them up. We give cards that you need to carry. I want you to go to the table and pick them up. Now I'm going to go a little bit further here. The picture of brain, it's kind of a beautiful picture. The only thing they evaluate in the brain is this brain stem right here at the base. In the unconscious person, you cannot evaluate the cortex. The cortex is the largest part of the brain. The cortex has to do with memory, talking, walking, that kind of stuff. You cannot do it in the unconscious person. And then the cerebellum is the second largest part of the brain. And you heard something today saying about the I did not mean to do that. The criteria in England is different. It's different because in England they admit that they can't, that they don't use the cortex or the cerebellum, and they make it just a brainstem. In the United States, they talk about whole brain death, but they don't evaluate the cortex or the cerebellum. It's a misleading thing that's going on. The most you can evaluate in the unconscious person is the brainstem, and that's all they evaluate in the United States, in spite of what they try to sell to you. And that's a pretty picture with colors and that kind of thing, but we'll go on. Okay, the apnea test, I have to tell you, the parents get, the relatives get little or no information, no consent. Consent is important, but what's really important is whether somebody does something or doesn't do something, but there's no consent. But can there be? How could there be consent to take your wife or your daughter off the ventilator? They're on the ventilator, they look like they're okay, their color's good and everything. And how can you agree to take them off the ventilator for 10 minutes to suffocate them? And I mean suffocate them. Their carbon dioxide goes up, and that makes the brain swell, it makes them worse. And not only that, when the carbon dioxide goes up in the lungs, it makes the lungs, their blood vessels constrict. It makes them get worse. And no one should ever get an apnea test. Remember this. Remember I told you, remember interdependence? Second thing to remember is no, no, no to the apnea test. Do not allow anyone to ever have an apnea test. It's an awful test. And so learn that part of it. Okay, now that's the second heart transplant. The first one was done in Johannesburg, South Africa. 3 days later, this little baby packed in ice. It's awful. That was in preparation for taking his organs. 3-day-old baby. They cut the beating heart out and gave it to an 18-day-old baby in Brooklyn, New York. And at the end of that time, both babies died pretty quickly. First one when they cut out the heart, the second one within hours. It was illegal, immoral, and so what did they do? They set up a committee at Harvard and invented brain death. In 1968, they just set up a committee and invented it. Now, I want you to turn the lights down because I want you to see this next one. The next one is out of a textbook. It's about taking organs from a deceased donor. Deceased means brain dead, from a brain dead donor. The deceased, the Latin word, the root of it is decessus. It means death, departure from life. And you'll see in this, and if some of you are kind of squeamish, just look to the side. And if you're not so squeamish, look at it and watch it. But this is what a transplant is like. Once they have this declaration of brain death, then they take them to the operating room. They cut them open from the top of the sternum to the pubis, and this you'll see the beginning of the procedure. It won't take but a few seconds. So you know sound, but I'll tell you about it. You see the tissues are pink. This is the sternum that's being divided. Then the separation, we use a mechanical device to spread it open. That's the pericardium. The tissues are, you see the heart beating behind there, separating the heart, the pericardium. Then at the top, you see that heart. That's a beating heart. That's a beating heart that's cut out. That's the beginning of a transplant procedure. You can turn the lights back up again. Thank you. So you see what it is. Every time that they do the transplant, that's how they do it in somebody who's brain dead. Now, brain dead is called heart-beating donor, and then they don't get as many organs as they'd like. So then they've invented this other thing called cardiac death. DCD, donation after cardiac death, or NHBD, non-heart beating donor. The heart beats, but not strong enough for a pulse. So they wait till they're without a pulse for 5 minutes or 2 minutes, depends on where you are. Not till you're without a heartbeat, but till you're without a heartbeat strong enough to cause a pulse. So without a pulse for 5 minutes or 2 minutes, and 2 babies in Colorado, they were without a pulse for 75 seconds. And that was the signal to cut their beating hearts out and give them to someone else. And so how do they get organs? They get organs from brain death, organs from heart death. And what's the new way? The new way is from drug overdose. It's so awful. That's what's happened to poor Takesha. Overdose, it's an awful thing. People that deal with addiction in their family, it's a terrible thing, but what's going on in our society now, they take unfair advantage